Cardiovascular disease (CVD) is the #1 cause of death among individuals over 80. And it's not surprising. As the body ages, the heart and blood vessels undergo significant wear and tear. Arteries naturally stiffen, plaque builds up, and the heart has to work harder to pump blood efficiently throughout the body. This combination makes seniors highly susceptible to conditions such as coronary artery disease, congestive heart failure, atrial fibrillation, and heart attacks. One of the most dangerous aspects of cardiovascular disease in older adults is that it often develops silently over decades. Hypertension, high blood pressure, is common in seniors, and if not managed correctly, it increases the risk of heart attacks, strokes, and kidney failure. In many cases, seniors may not experience typical chest pain during a heart attack. Instead, they might feel fatigue, nausea, or shortness of breath, which can lead to delayed diagnosis and treatment. Cholesterol also plays a vital role. Over time, LDL bad cholesterol builds up in the arteries, forming plaques that restrict blood flow and raise blood pressure. Reduced blood flow to the heart muscle leads to angina, or, in more serious cases, myocardial infarction, heart attack. Many seniors may not even be aware that their arteries are narrowing until it's too late. Another key factor is lifestyle habits. By age 80, many people have experienced decades of exposure to risk factors such as smoking, poor diet, lack of physical activity, chronic stress, and unmanaged diabetes, all of which accelerate cardiovascular aging. Even if a person quits smoking or starts eating better in their senior years, the cumulative damage may already be present. However, the good news is that CVD is largely preventable and manageable. Even after 80, seniors can significantly reduce their risk through a few key strategies: routine monitoring of blood pressure, cholesterol, and blood sugar, medications to manage hypertension, heart rhythm, or cholesterol, moderate physical activity, such as walking or light aerobic exercise, which improves circulation and strengthens the heart muscle, heart-healthy diets, including foods rich in fiber, omega-3 fatty acids, and low in sodium and trans fats, avoiding tobacco and limiting alcohol, both of which negatively impact heart function. Regular visits to a cardiologist or primary care physician are essential for seniors to catch warning signs early. Diagnostic tests like EKGs, echocardiograms, and stress tests can help track heart health. Cancer becomes increasingly common after age 80, and it is one of the top 5 causes of death in this age group. This isn't a coincidence. Aging, one of the biggest risk factors for cancer, as the body's natural defense systems become less effective over time. The immune system weakens, DNA damage accumulates, and cellular repair processes slow down. These changes increase the likelihood that cells will mutate and grow uncontrollably, leading to cancer. Among the elderly, common cancers include prostate, breast, lung, and colorectal cancer. Prostate cancer is particularly prevalent in men over 80, while breast and colon cancer affect both genders. Lung cancer, often linked to a history of smoking or environmental exposure, is especially deadly due to late detection. One major challenge is that cancer symptoms can be vague or mistaken for signs of aging. Fatigue, weight loss, or changes in appetite might be attributed to getting old rather than something more serious. This delay in diagnosis means many older adults are diagnosed at later stages when treatment options may be limited or less effective. Early detection becomes critically important, even in old age. Regular screenings like colonoscopies, mammograms, and PSA test scan identify cancer in its earliest, most treatable stages. While some doctors may be cautious about performing aggressive screenings in very elderly patients, especially those with other health conditions, individualized assessments are key. A healthy 82-year-old with good functional ability may benefit from screenings just as much as someone younger. Another issue is that cancer in older adults often coexists with other chronic illnesses, such as heart disease or diabetes, which complicates treatment. Seniors may not tolerate chemotherapy or radiation as well as younger people, and their recovery can be slower. This is why prevention and early management are even more crucial. Despite these challenges, many types of cancer are highly preventable or manageable with lifestyle changes. For instance, avoiding tobacco use reduces lung, throat, and bladder cancer risks. A healthy diet high in fruits, vegetables, and fiber, and low in red meat and processed foods, can lower colon and stomach cancer risk. Staying active helps maintain immune function and reduces obesity-related cancers. Routine health checkups and being aware of bodily changes like new lumps, bleeding, or unexplained pain can lead to earlier diagnoses. Moreover, advances in targeted therapies and immunotherapy are offering safer, more effective cancer treatments for the elderly. Palliative care and integrative oncology approaches also provide comfort and quality of life, even in advanced stages. In summary, while cancer risk undeniably increases with age, it doesn't have to be a death sentence. Through regular screenings, healthy living, and personalized medical care, seniors over 80 can take strong steps to catch cancer early, treat it effectively, and maintain independence and vitality for years to come. Respiratory diseases, particularly chronic obstructive pulmonary disease (COPD), are among the most serious and deadly health issues for individuals over 80. With age, the lungs naturally lose elasticity, and the chest wall becomes stiffer, making breathing less efficient. When this natural decline is compounded by a history of smoking, pollution, exposure, infections, or untreated asthma, the risk of developing chronic lung conditions skyrockets. COPD, which includes chronic bronchitis and emphysema, is especially dangerous. It slowly narrows the airwaves, damages lung tissue, and impairs airflow, making it difficult to breathe, even with minimal exertion. Many older adults with COPD experience chronic coughing, wheezing, shortness of breath, frequent respiratory infections, and fatigue. Over time, this constant strain on the respiratory system leads to reduced oxygen delivery to vital organs, increasing the risk of heart problems, cognitive decline, and overall frailty. One of the main concerns with COPD in the elderly is its progressive nature. Symptoms may start mildly and be dismissed as normal aging or seasonal allergies. However, without proper management, the disease can worsen silently, resulting in sudden, life-threatening complications like pneumonia, respiratory failure, or severe breathlessness requiring hospitalization. Additionally, pneumonia, often a secondary condition in COPD patients, is a major cause of death in seniors over 80. The weakened immune system makes it harder for the body to fight infections, and the diminished lung capacity in COPD patients means even mild infections can become lethal. Many elderly individuals die not directly from pneumonia but from its complications, such as sepsis or fluid buildup in the lungs. Prevention and early management are essential to reduce the risk of respiratory-related deaths. Here are key strategies. Smoking cessation is the most critical intervention. Even quitting late in life slows disease progression and improves lung function. Vaccinations against influenza and pneumococcal pneumonia are vital for protecting vulnerable lungs. Pulmonary rehabilitation, including breathing exercises and physical therapy, helps improve lung efficiency and stamina. Inhalers and medications, like bronchodilators, can relieve symptoms and prevent flare-ups. Oxygen therapy may be prescribed in advanced cases to maintain healthy oxygen levels in the blood. Maintaining good indoor air quality is also crucial. Seniors should avoid exposure to smoke, strong chemical fumes, and dust. Living in a clean environment supports better breathing and lowers infection risks. Nutrition and hydration play a surprisingly important role in respiratory health as well. A diet rich in antioxidants and anti-inflammatory foods like leafy greens, berries, and omega-3s can support immune function and reduce inflammation in the airways. In summary, chronic respiratory diseases like COPD are not just breathing problems, they're life-threatening conditions that demand attention, especially after age 80. With vigilant management, timely medical care, and lifestyle adaptations, older adults can breathe easier and dramatically reduce their risk of respiratory-related death, allowing them to live longer and more comfortably. After age 80, the risk of stroke increases significantly, making it one of the top causes of death and disability among the elderly. A stroke occurs when blood flow to the brain is interrupted, either due to a blocked artery ischemic stroke or a burst blood vessel hemorrhagic stroke. In both cases, brain cells begin to die within minutes, leading to permanent damage or even death if not treated quickly. The reason strokes become more common in later years lies primarily in the aging of the vascular system. Over time, arteries lose their elasticity and become narrower due to atherosclerosis, the buildup of plaque made of cholesterol, calcium, and other substances. This stiffening and narrowing restrict blood flow and significantly raise the chances of a clot forming and blocking a brain artery. Hypertension, high blood pressure, is the most significant risk factor for stroke in seniors. Unfortunately, it is often referred to as the silent killer because it produces no obvious symptoms until it causes major damage. Prolonged high blood pressure weakens the walls of arteries, making falls are one of the leading causes of injury-related death and long-term disability in people over 80. What may seem like a minor accident to a younger person, such as slipping in the bathroom or tripping over a rug, can be catastrophic for seniors. At this age, even a simple fall can result in a hip fracture, head trauma, or spinal injury, leading to a rapid and often irreversible decline in health. One major reason falls are so dangerous in the elderly is age-related frailty. As people age, they experience a natural decline in muscle mass, bone density, coordination, and balance. Conditions like osteoporosis, brittle bones, make the skeleton more vulnerable to fractures, especially the hips, spine, and wrists. Additionally, reduced reaction time and slower reflexes make it harder to catch oneself during a fall. Hip fractures, in particular, are extremely serious. According to research, nearly 1/3 of seniors who suffer a hip fracture die within a year. Not necessarily from the fracture itself, but from the complications that follow. These include blood clots, pneumonia, infections, and the effects of prolonged immobility, such as muscle wasting or pressure ulcers. Moreover, many elderly patients never regain their previous level of independence and often end up in long-term care facilities. Other complications can arise from head injuries, especially if the person is on blood thinners, commonly prescribed to prevent strokes or heart attacks. A fall can cause a brain bleed, even if there is no visible external injury, which can lead to confusion, coma, or death if not detected promptly. There are many contributing factors to falls in seniors over 80. Poor vision or hearing, which can impair awareness of surroundings. Medications that cause dizziness, drowsiness, or blood pressure drops. Chronic conditions like Parkinson's disease, arthritis, or diabetes that affect balance and mobility. Cluttered or poorly lit home environments that increase tripping hazards. Fortunately, falls are highly preventable with the right strategies. Home safety modifications: install grab bars, improve lighting, secure rugs, and use non-slip mats. Use of mobility aids like walkers or canes when necessary. Strength and balance exercises, such as Tai Chi or gentle yoga, can significantly improve coordination and muscle tone. Regular vision and hearing checks to ensure sensory functions are optimized. Medication reviews with a healthcare provider to eliminate or adjust drugs that may increase fall risk. Seniors should also avoid wearing slippery footwear and should rise slowly from sitting or lying positions to avoid sudden drops in blood pressure, orthostatic hypotension. In summary, falls are not just accidents, they are potentially life-altering events for people over 80. Preventing falls through physical fitness, safe environments, and medical vigilance can mean the difference between living independently and facing permanent disability or premature death. It's not just about avoiding injury, it's about preserving dignity, freedom, and quality of life in the final decades. As we age, one of the most significant physiological changes is the gradual decline of the immune system, a process known as immune. After the age of 80, this weakening becomes especially pronounced, making even common infections far more dangerous and potentially life-threatening. What a younger adult might overcome in a few days, a cold, a urinary tract infection, or a bout of the flu, can spiral into serious complications in an elderly person. The immune system has two arms: innate immunity, the body's first line of defense, and adaptive immunity, which creates targeted responses. In older adults, both are diminished. The production of T cells and B cells slows down, response times become sluggish, and the body's ability to remember past invaders weakens. This means infections take hold more easily, spread faster, and are harder to eliminate. Some of the most dangerous infections for those over 80 include pneumonia, a major cause of hospitalization and death in seniors. It often develops quickly, especially after a cold or flu, and can lead to respiratory failure. Urinary tract infections (UT) is common in older adults, especially those who are immobile or UT can rapidly escalate into sepsis, a life-threatening systemic infection. Influenza flu, what might be a mild illness in younger people, can be fatal in the elderly. due to complications like pneumonia or dehydration. COVID-19, this virus highlighted just how vulnerable the elderly immune system is. Mortality rates from COVID-19 were significantly higher in those over 80. Skin infections, even small wounds or pressure sores can become portals for bacteria, leading to cellulitis or systemic infections. Additionally, seniors often show atypical signs of infection, making diagnosis challenging. For instance, instead of a high fever or localized pain, an elderly person might present with confusion, weakness, or a sudden drop in appetite, symptoms easily dismissed as normal aging. Unless a clinician is alert, preventing infections becomes a critical priority after age 80. Here are essential strategies. Vaccinations. These include annual flu shots, pneumococcal vaccines, shingles vaccines, and COVID-19 boosters. Immunizations can significantly reduce both infection rates and severity. Proper hygiene practices, regular hand washing, oral care, and wound care help prevent the spread of germs. Nutrition and hydration. A well-nourished body can better defend against illness. Key nutrients include vitamin D, zinc, and protein, all of which support immune health. Avoiding unnecessary antibiotic use. Overuse can lead to antibiotic resistance, making future infections harder to treat. Early medical intervention. Seniors and caregivers should watch for subtle signs like confusion, lethargy, or reduced mobility and seek care promptly. Cognitive decline is one of the most significant yet often overlooked contributors to mortality in people over the age of 80. Conditions such as mild cognitive impairment, MCI, dementia, and Alzheimer's disease become increasingly common in advanced age and can drastically impact an individual's ability to care for themselves, manage their health, and avoid dangerous situations. As cognitive function decreases, the risk of death indirectly rises, often not from the cognitive condition itself, but from its complications and consequences. When the brain's cognitive functions, such as memory, attention, reasoning, and problem-solving, begin to deteriorate, daily living becomes challenging. Seniors may forget to take medications, miss important medical appointments, or fail to recognize symptoms of serious illness. For instance, an older adult with memory issues may not recall experiencing chest pain, confusion, or changes in vision, indicators of heart attacks, strokes, or infections. In more advanced stages of cognitive decline, individuals may struggle with basic hygiene, nutrition, and safety, such as forgetting to eat or drink, leading to malnutrition or dehydration, leaving the stove on, or wandering away from home, risking injury or exposure, mismanaging medications, either taking the wrong dose or skipping them entirely, which can worsen chronic conditions like diabetes, hypertension, or heart disease. All of these factors can lead to a downward spiral in health, especially for those living alone or with minimal supervision. Cognitive impairment also increases vulnerability to falls, which are already a leading cause of death in the elderly. Disorientation or poor judgment may lead a person to move unsafely, ignore obstacles, or misuse walking aids. Combined with physical frailty, this significantly raises the likelihood of fall-related injuries. Emotionally and psychologically, cognitive decline can lead to depression, anxiety, and social withdrawal, all of which can reduce a person's desire or ability to engage in self-care. Apathy, for example, may cause seniors to neglect their personal hygiene, diet, or social interactions, further increasing isolation and health decline. Another concern is resistance to care. Seniors with cognitive decline may become suspicious, fearful, or agitated when family members or caregivers attempt to help. This can result in mistreatments, delayed hospital visits, and an overall reduction in effective medical support. However, early detection and proactive care can help slow the progression of cognitive decline and reduce its deadly consequences. Routine cognitive screenings during checkups help catch memory issues early. Structured daily routines and environmental cues like labeled medication organizers can assist with memory and tasks. Professional caregiving support or assisted living may be necessary in more advanced stages. Then engaging in mental stimulation, physical activity, and social interaction has been shown to slow cognitive deterioration. Proper management of cardiovascular health, blood sugar, and sleep can help protect brain function after the age of 80. Many health risks increase significantly, but they are not inevitable. One of the most powerful truths about aging well is that preventive care and lifestyle adjustments can dramatically reduce the risk of death and disability. Even in advanced age, seniors can take meaningful steps to improve their health, prevent complications, and live longer, more independent lives. Preventive care refers to routine health services and screenings designed to detect problems early before they become serious. This includes regular checkups, vaccinations, cancer screenings, cardiac monitoring, and bone density tests. Early detection of diseases such as hypertension, diabetes, cancer, or osteoporosis gives healthcare providers a better chance to intervene early, often with less aggressive and more effective treatments. For example, identifying high blood pressure or irregular heart rhythms early can help prevent